So they're going to be doing similar to the first team, except instead of going to downtown Toronto, they're going to Brampton. And I can tell you from the reports on the ground from the team that's there now, it's much needed and welcomed help. They've been welcomed with open arms. They recognize that how stressed the system is and how stressed the physicians and nurses are. And this little bit of reprieve, even though it's small, goes a long way to helping the morale of the teams that are working so hard on the front lines in Toronto. And I'm sure this team is going to do the same in Brampton. So we're very proud of the team. We're very proud that they stepped up. And this is welcome help to our Canadian neighbors.
Has your position changed on the Canadian Medical Association's recommendation of reallocating vaccines based on need?
No, our position has been the same from the very beginning. All the provinces made their plans with respect to the vaccines based on a per capita model, and so we're still sticking with that right now.
Do you think that plans could change perhaps because of these recommendations from the office that you were, or I guess you still are a member? I don't know if you are or not.
I'm still a member of the CMA, proud still member of the CMA, but no, we're sticking with our model and how we've looked at this from the very beginning is a per capita basis of distribution from the federal government. We have to make plans for that. There's a distribution network that has to occur here within the province. We need to make sure that we're looking after our citizens, and we're doing what we can to help by sending medical professionals to other jurisdictions. I understand the position of the CMA, but we are, and frankly, aligned with all the other premiers across the country and the Prime Minister right now, that that's the position that we're taking. Yeah, as I've said before, I believe right now that Ontario has a forest fire. We're sending firefighters. They don't need a fire prevention unit because there's an active fire burning. So we're sending firefighters. The vaccines are fire prevention, and we're using that to prevent a fire from outbreaking here, and I think that's the most prudent and responsible thing to do with our vaccine allocation. Yeah. Pardon me, how did you say? Oh, I have a tremendous amount of FOMO. It feels weird to see Allison go and then to see Art and Michelle go and not have red bags packed and be a part of the team. It's been a harder adjustment for me leaving the medical profession or leaving it to the side than I ever would have thought, and seeing the empathy and care that these Newfoundlanders and Labradorians are providing elsewhere. Certainly it touches on my heartstrings and makes me have a tremendous amount of fear of missing out, if you will. Yeah.
There are Newfoundlanders and Labradorians who are in communities where they may be missing nurses, for example.
Absolutely.
The coast of Labrador, the nursing positions are vacant. What do you say to them? Do they see nurses leaving the province saying, hey, we have extra to spare, when they say, hold on, my community doesn't have enough?
Yeah, and as I've said from the beginning, that's a false equivalent. You know, like we're not really comparing apples to apples there. This is an acute crisis need. We've been working with the Nurses Union to address through different models. Had a great call with Yvette the other day about how we can look at nursing and frankly, physician supply in some of these rural and remote communities. But right now, this is an acute crisis that's facing Canada, and I'm very proud that Newfoundlanders and Labradorians have stepped up. So it's not the same. You know, of course, there's similarities, and that's the logical fallacy involved in false equivalency. But they're similar, but it's not the same scale. It's not the same demand right now. And I don't subscribe to the fact that you have to do one and not the other. You know, if there's a global crisis, just because Canada is not in a good financial or fiscal position, should we not be obliged to help elsewhere? I think that we need to make sure that we're managing both at the same time. We've committed to working with the Nurses Union. Had a great call with her the other day about other models of providing care, like fly-in models that they use elsewhere in Canada and the territories, and maybe that's the solution. But we're working hard with them for the medium and long-term solutions that those communities need and deserve. Right now, you know, obviously myself and Dr. Fitzgerald talk every morning. We're looking closely at the numbers and following them very closely. We follow the epidemiology here, the percent positivity testing here, and we're still, despite the uptick in the numbers, which is somewhat weighted in the boat offshore, as we know, we're still doing fairly well here compared to the rest of the country. As I've said from the beginning, and I was very adamant with the Prime Minister and Minister LeBlanc, should the situation change here in Newfoundland and Labrador, we'd be pulling all these people back right away. And they understand that and have suggested that they would provide the equivalent resources to get these people home immediately should it be required. She's said that it's been portrayed very accurately, so it's not been exaggerated for flair, if you will, or theatrics. It's been portrayed very accurately. She's working very hard, long days, and it's been very welcomed and needed. They're really stressed and pushed to their maximum. These teams are working together very closely, and that's how we would work here. I think one of the encouraging things actually that she's kind of conveyed to me when I was volunteering on the COVID unit here, it's set up the same. We have to recognize that there's only a handful of critical care physicians across the country. There's only a handful of respirologists across the country. So, you have to put medical teams together of nurses and other physician specialists together to run these COVID units. And so that's why, you don't have to be an ICU doc to contribute. And she's had, I don't want to betray any patient confidence or even trip into that area, but some of the stories that she's been telling or conveying to me without relaying any patient information has certainly been, it's been sad and tough on her, and heartwarming to know that she's there providing help and assistance to the patients and the families in need.
That team paired up individually with other workers in Ontario. This team, they're sticking together?
My understanding is there's a bit of both going on in Brampton. They're going as a unit to Brampton, but they'll probably be deployed a bit separately throughout the hospital system. We need to go where this is not our request, right? We're answering a request from Ontario, and we'll fill in the positions that they need. They do a needs assessment, and we try to fill those needs. Peter?
Newfoundland and Labrador is so far the only province that has sent medical assistance to any other province. Do you hope that this kind of gives a little nudge to other provinces as a bit of an encouragement that if we can do it, they can do it as well?
That's what I said on the First Minister's call the other Thursday evening past. There was a great deal of gratitude from Premier Ford on that call, and from the Prime Minister, and Minister Freeland, the Deputy Prime Minister, was on the call as well. They were very thankful for Newfoundland and stepping up. And I said, if there's any, if we can spurn on some other people to help in this time of need, certainly that would be welcomed, and people should evaluate where they are, and if they can, it's within their capacity. It's always within your own capacity, so I'd never pretend to speak on other premiers' behalf, but recognizing your own capacity limits, if you can help, you should help. And frankly, Newfoundland and Labrador has also shown strong leadership and action despite external pressures of elections and everything else, as we all know, in taking definitive, strong public health measures, and we've shown that can work. And I think that should be a model that others across the country also look for when trying to grapple how to get these numbers under control and back to normal. I think the last time I looked, there was about a list of about 40. So there's been a lot of people put their hand up, and look, we wouldn't expect anything else from Newfoundland and Labrador. When there's a time of need, a time of crisis, Newfoundlanders and Labradorians have historically and for generations been the first to answer the call. And so I'm not surprised at the number, despite the challenges of capacity within our own healthcare system here. In terms of choosing who goes, that's kind of been a combination between the two departments of health, between Ontario and Newfoundland and Labrador, and looking at their needs assessment and looking what the system here can accommodate. So I hate to use Allison as an example, but she's part-time, and so her shifts are a little bit more shiftable and absorbable within the system. So consequently, that's someone who's a bit more disposable, if you will, to some other jurisdiction. So it's of needs and flexibility, needs from Ontario's side and flexibility within our own system, and trying to marry the two as the best of our abilities.
Okay, last question.
Oh, sorry, and to speak, we're not sure yet, to answer your question. I really have a great deal of hope that the vaccines are going to start to win within the next couple of weeks, and you're going to see an even greater impact of the vaccines, especially in Southern Ontario. We're looking at 35% of the Canadian population with one dose. We're seeing good evidence that one dose is effective at not getting rid of COVID altogether, but eliminating hospitalizations, severe disease, critical care occupancy. So I'm really hopeful that as the vaccine program ramps up, and we're expecting 2 million doses this week, et cetera, that this will really take hold, and the vaccines will win over the variants despite these hotspots.
Have you had direct discussions with the board about
No, he's never asked, to be fair to him. But we have talked about it in generalities on in the Premier's call, in the Atlantic Premier's calls. And Premier Ford has been incredibly grateful for whatever help we could offer, and he recognizes the limited supply of vaccines. But he's been nothing but grateful and supportive of Team Newfoundland's effort to help Team Ontario and ultimately Team Canada.
Okay, thank you folks for this time.
Good morning. I'm Art Rideout. I'm a reconstructive surgeon here at Eastern Health. I want to thank everybody. The Premier, it's different not being able to bring him along on a mission, but I'm very thankful to be here, very proud to be doing it. It's a good thing, trying to support others. I think it's something that the RHAs, the provinces, every level, all the people here making this happen, I'm just proud to be part of it.
So you're a reconstructive surgeon. Most people might not think in the middle of a COVID crisis you'd be one of the top people. So what exactly are you going to be doing now?
So we've been assigned to Brampton Civic Hospital to provide supportive care in their COVID unit. And that's something that Eastern Health would have asked me and other surgeons to do. So providing supportive care to a group that hasn't had a break for a long time, I think it means a lot.
This isn't your first time going into medical-related situations. How do you compare this to some of the other things you've done?
So the theme is the same. It's somebody needs help, and if I can do a little bit to help them along the way, well, that's the way I was raised. So just being able to help somebody anywhere is a good thing, and if we can do it in our own country, I think that's a special thing.
What are you hearing from your colleagues up in Ontario?
So it's dire. Their numbers and volume is much more. Their capacity is being stretched. We all know there's people being transferred because of ICU care and need. So that just speaks to the volume and the dire situation that they're dealing with.
How are you feeling as you
I'm nervous. This is a new one. This is I'm always nervous in front of the mic, but I'm excited and I can't wait to get there. I just want to be part of it. I want to help. So, yeah.
What did you tell your family about
So they're always very supportive. They're very proud, and I think they'd be disappointed if I didn't step up. At the same time, it's something we do, to give back. Something, like I said, I was raised with. I got to say, Happy Mother's Day to my mom, Rosalita Rideout. I got to do that. And to all the moms, Mary and all the others that may be away from their loved ones during COVID. So, Happy Mother's Day. I think it's a way. I don't think it's a competition. I think, if you lend a hand to a neighbor, I think that's what we all do. That's, again, how we were raised. So if you can, you should. So I take that attitude.
Anything else you want?
No, I did the Mother's Day. That's good. Thank you so much. I appreciate it.
Okay, so I'm Michelle Murphy. I'm a nurse here in Eastern Health, and I'm presently working in the day surgery program. Michelle I have a lot of emotions. I'm nervous. I really don't know what we're facing. I'm excited. I'm, honored to be able to give back in my own country. I've traveled a lot with Team Broken Earth. It's kind of strange being here today, and the Premier's on the other side of the fence. He would normally be the one leading us all now and get aboard that plane. But I'm excited. It's a good thing. I think it's great that we can do this, and I never dreamed I'd have the opportunity to give back here in my own country. So it's good. You don't really. I don't know. I haven't really thought about it much. I mean, it was quick happening. I found out Thursday, and here we are. It's Tuesday. So I had, a lot of emotions, and sometimes a bit of panic. Can I do this? What am I facing? How's it going to be? But I think I have the personality for it, and I think I'll be fine. Yeah. Because the opportunity to give back. I've been to Third World. I've given back there. I love it. Nursing is my passion. I love being able to help people. And today I'm going to give back right here in my country.
As a healthcare worker, what do you think about the debate surrounding this whole enterprise where, people in other regions are saying, well, we could use healthcare to help, people in Labrador, for example?
I don't think there's really any comparison. We're in the middle of a pandemic, and Ontario is facing some really tough times. And the stories coming out of Ontario is they're exhausted. We're not. We're exhausted in maybe some different areas, but nobody's suffering here. There's no comparison between here and Ontario right now.
What are you hearing from your colleagues up there?
That it's busy. The staff there are exhausted, and they've been welcomed with open arms, and they're looking forward to us coming. And you know what, if I can go there and I can give a nurse an extra 5 minutes on her coffee break, or I can hold the hand of somebody, or I can wipe the tear of somebody, then I'm helping.
What's your experience treating COVID here?
I don't really have a lot of experience because we've not really had much COVID here. But, I have the knowledge, and I feel like, I can do it. I'll adjust.
Anything else you want to ask?
No?
What do your boys say about it going?
Well, I sat them all down and I said, guys, Ontario's called for help, and I need all of your honest opinion, how you feel about me going. And their immediate response was, you're not asking us, Mom, you're telling us you're going. And that was true. And that was it from there. And no, they're very proud. There was no hesitation. This morning on deck, they were, good luck, Mom, we're proud of you, take care of yourself, just be safe. Yeah. Pardon me? Three. They are 20, 16, and 15. Yep.
Do you know how long you're going?
I'm going for 14 days.